In this video, we will be discussing setting up for and taking impressions, as well as pouring models once the impressions are complete. In our office, we have 3 different size trays. These trays are used when taking impressions for night guards, mouth guards for sports, retainers, whitening trays, dentures, removable partial dentures, surgical stents, wax up, and at times, final impressions for crowns or bridges. If taking impressions with alginate, you will need the alginate material scooper, cup with water, water scooper, bowl, and mixing spatula. If using Silginate, you will only need to walk to the station to fill your tray. When taking a preliminary impression, you will need an anterior, quadrant, or posterior disposable tray and a bite registration or blue mousse. Before starting impressions, make sure you explain the procedure to the patient. Ask them if they have had impressions before and if they have a gag reflex. If so, go over the tips to help control gag reflex as much as possible. You will hand them a chapstick or any available ointment to moisturize their lips. Ask the patient to open their mouth so you can get an idea of the tray size needed. If you are unsure on what size will be needed, grab all 3 and try them in to find the best fit. The tray should extend 2 to 3 millimeters beyond the last molar area and below both the lingual and facial surfaces of the teeth. You can place a finger inside their mouth behind the tray to make sure that you do not feel tooth surface. Once you have found the tray size, prepare to fill with putty material. The time from which the alginate powder material is mixed with water until it is completely set is called the gelatin time. The gelatin time differs depending on the type of material used. Most of the materials are supplied in 2 types. Type 1 is a fast set alginate and type 2 is a regular set alginate. The gelatin time for both is broken into 2 different increments. The setting times can be altered. The most convenient way to control the setting time is to adjust the temperature of the water. All of the alginate materials are supplied with their own specific measuring devices for both the powder and the water. First, read the manufacturer's directions for dispensing the material. Usually, it takes 2 scoops of powder to 2 increments of water for each mandibular impression. 3 of each is normally needed for the maxillary impression. These may alter depending on the size of the patient's arches. It is important that the correct amounts of both powder and water are used. Fill the measuring spoon for powder by overfilling and then leveling off with the spatula to get an accurate measure. Dispense 2 corresponding scoops into a second flexible rubber bowl. When ready, place the water into the powder. Mix the water and powder first with a stirring motion, then mix by holding the bowl in one hand and make a figure 8, rotating the bowl occasionally and scraping the sides with the flat end of the spatula to incorporate the material through pressure against the side of the bowl. The mixing time for type 1 fast set is 30 to 45 seconds. Type 2 or regular set is 1 minute. Upon completion, the mixture should be homogeneous and creamy. When the material is mixed thoroughly, load it into the impression tray. Use the flat sides of the blade to condense the material firmly into the tray. If necessary to further smooth the surface, take a gloved hand, moisten, and smooth the top. We recommend that you start with the mandibular impression. That way, in case the patient does have a gag reflex, it's easier for them to do the lower one first and then the upper. You want to start off facing the patient. You will retract their cheek slightly, invert the impression tray so the material is towards the teeth. Turn the tray so it passes through the lips with one side of the tray entering first, and then using your other hand to retract the opposite corner of the mouth, place the tray all the way in. When the tray is completely in the patient's mouth, center it above the teeth. Lower the tray onto the teeth, placing the posterior area down first, pressing onto the molars. Leave the impression tray slightly anterior. Have the patient raise the tongue and move it side to side to ensure that the lingual aspect of the alveolar process is defined in the impression. Retract the lip using the other hand. Complete seating the impression tray, pushing it slightly down as you come towards the anterior of the mouth. Allow the lips to cover the tray close to the handle. Hold the tray in the patient's mouth using 2 fingers on the back of the tray, 1 on each side. You want to continue to hold until the material has set, that way the tray does not move. Periodically, check the excess material around the edges of the impression tray or in the bowl to determine when the material has set. The material should feel firm and not change shape when pressed. To remove an impression, you want to first loosen the tissue of the lips and cheek around the periphery with fingers to break the suction-like seal. Place your fingers of the opposing hand in the opposite arch to protect the adjacent arch as the tray is removed. Remove the tray in an upward or downward motion depending on the arch. With a quick snap, turn it to the side and allow it to be removed from the oral cavity. Your next step will be to pour the model. You will need to mix your stone material for pouring. You will mix 2 scoops of stone with water filled to line 1 on the measuring cup. Using a spatula, slowly mix the particles together. The mixture is ready if the spatula can cut through it and it stays to the sides without changing positions. It should appear like whipped cream with a smooth, creamy texture. Once mixing is completed, you will begin pouring the models. Use the vibrator at low or medium speed. Hold the impression by the handle with the tray portion on the platform of the vibrator. Allow a small amount of plaster to touch the most distal of one side of the arch in the impression. When the plaster touches the impression that is on the vibrating platform, it flows down the back of the impression and into the anatomy of the teeth. Continue to add small increments of the plaster in the same area as the plaster flows around towards the anterior teeth and to the side of the arch. Using this technique allows the air to push ahead of the plaster material and eliminate bubbles. This produces a model that has detailed anatomy qualities. Add the plaster in this manner until it flows out the other side of the impression and fills the anatomic portion of the model.